Important things to know when you are pregnant for the first time. Signs which confirm you are pregnant. In the excitement of conceiving a baby, many a times, false symptoms lead to confusion. One should not get carried away by them, but understand the true signs which indicate that you are pregnant. One way to confirm your pregnancy is to conduct a home-based urine test using the kits available in the market or get a pregnancy test done from a doctor. Secondly, there are some typical first-time pregnancy symptoms which can ratify your pregnancy, like feeling of nausea, vomiting, back pain, mood swings, tender of swollen breasts, cravings for some specific food and missed periods. Visits to doctor for prenatal care are important. Many couples visit a doctor even before planning a baby to make sure the pregnancy will be healthy and devoid of any complications. Once you confirm your pregnancy, it is of utmost importance to visit your doctor regularly. It is essential because it can help gauge the mother's health as well as that of the fetus. Moreover, it is also necessary to curb any negative development at developing stage itself. Understanding your family medical history. Once you conceive, it is necessary to discuss with your mother, grandmother or aunts about their pregnancy. It is crucial to understand if there is any genetic problem or any birth abnormalities in the family line. Acquiring knowledge about such things can prepare you for any potential problems, and at the same time, it can make you cautious so that you seek necessary aids to avoid them. Medical tests are must. There are certain primary tests which every pregnant woman should undertake. These tests, which comprise of urine test, blood sugar test, thyroid test, hepatitis B test, etc., are suggested by your doctor to determine any deficiency or potential risk associated with pregnancy. It is advisable to do these tests at initial stages or if possible before conceiving. Sometimes there can be minor ailments which can be readily cured with medicines. Finding your gestational age. Pregnancy is divided into 3 stages, each consisting of 3 months. It comprises of first trimester, second trimester and the third trimester. With each passing stage, physiological changes occur in your body in the form of hormonal changes, blood pressure volatility, breathing and metabolism. One should monitor such changes from the beginning of the pregnancy to understand the other stages of pregnancy and your progress through them. Apart from that, it is necessary to take your delivery due date, which is mostly counted on the basis of the date of your last menstrual cycle. Bleeding can occur during pregnancy. Normally, the first sign of pregnancy is considered to be missed periods. However, many times, there can be bleeding in the initial stages of pregnancy. It is sometimes confused with menstrual bleeding. This kind of bleeding occurs when the egg travels down the fallopian tube and into the uterus, where it implants into the uterine lining. Bleeding which occurs due to the above-mentioned reason is known as implantation bleeding or spotting. The best way to recognize it is from its color. It is often found in brown or pink color, in contrast to the usual red color of your menstrual blood. Even though, how much weight gain is normal? Most of the women are frightened by the weight gain caused during their first pregnancy and are terrified after pregnancy to lose it at the earliest. How much weight one should gain is decided on the basis of your BMI, body mass index, before pregnancy. If you are already overweight when you conceive, then you are advised to put on less weight as compared to someone who is underweight at the time of conceiving. Above all, one should not forget that it is necessary that the fetus should get necessary nutrients to grow and have a healthy development. So eating the right meal and understanding the needs of the baby is required. What to eat and what not to eat. A lot of care has to be taken when one is pregnant, especially in terms of diet and nutrition. Along with a regular dose of vitamin and health supplements, one should try to have a nutritious, wholesome and balanced diet. Many times, a doctor will provide a suitable diet chart as per the particular body's needs. Apart from that, it is suggested to stay away from alcohol and caffeine products, as this can increase the chances of premature delivery, birth defects and underweight babies. Exercising and walking are essential. Many times, because of the fatigue and dizziness felt during pregnancy, women avoid exercise and walking. It should be noted that conceiving is no excuse for not doing any exercise. Proper exercise and moderate walking are must-do for first-time pregnant mom because it helps to strengthen her muscles and makes her strong to endure the pains of pregnancy. Thus the idea of doing exercise is not to reduce weight but to keep oneself healthy and active. Before starting any exercise, one should unfailingly consult the doctor. There can be discomforts during pregnancy. It is not an easy job to be pregnant. There will be discomforts throughout the pregnancy cycle. Many activities which previously you could do freely would now be either banned or would become difficult for you. Certain activities like standing for long, constipation, and vomiting can make one feel miserable. But all in all, discomforts depend upon how you take them. If you accept your uneasiness and learn how to live with them, it shall reduce your anxiety. Travel during pregnancy is possible. It is debatable whether one should travel during first pregnancy. In the initial stages it seems easy to travel, but during the later stages one should try to avoid or be a very cautious traveler. There are many airlines which restrict women travelers who are more than 36 weeks pregnant. But if in any case travel is unavoidable, you should first consult the doctor and make yourself aware of any hazards you may face while traveling. Many times, a doctor's certificate is prerequisite for travel. Which place would you like for birthing? You should plan the place, hospital, nursing home, etc. where you would like to give birth. It is important to choose a place that is best for you and will suit the needs of you and your family. The hospital should be chosen on the basis of the expertise of their doctors, their credibility, their visitation hours, hygiene and other factors like distance and neighborhood. Selecting a place well in advance and making visits there should make you more comfortable for your D-Day. What is labor pain? When your due date comes nearer, there are chances of you going into labor pains. It is necessary to consult the doctor and understand what is going to labor exactly means. If you know it well, then it shall be easy for you to handle your labor with no difficulty. One quick sign of labor is frequent contractions which increase in duration as well as intensity. Many times, walking is recommended during early labor because it makes women feel more comfortable. Necessary things for baby should be shopped beforehand. In order to avoid last-minute rushes, one should always plan in advance what things will be required after delivery. Few clothes, baby mats, baby blankets, warm clothes depending upon the season and baby feeding equipment should be shopped in advance. Such kind of shopping can be an enjoyable experience for a to-be mother and increases her connection with her baby. Learning and understanding childcare and parenting. When one is pregnant, a doctor is the best guide to help you with the worries you are experiencing with your baby. After delivery, a sudden responsibility of childcare and parenting can be difficult for many people. Thus, one should try and gain as much information on the same, through friends, relatives, or by reading various books available on the above subject. All this should be learned in advance so that you are well equipped once your child is delivered. Thanks for watching this video. Please like, share, and subscribe channel for more health tips. Have a nice day.